Gonzalez, Gonzalez.
Thank you.
Okay. I'm from Argentina. I'm 45 years old. I'm a doctor. I'm a pediatric cardiologist here in Montgomery. I've been in the U.S. for 13 years. I became a citizen of the United States 3 months ago. I have 4 kids. First of all, I want to acknowledge this Silas and what she believes. We stand in opposite sides, but I admire in such a human way that you stand for what you believe, even when I don't agree. And I want to talk about a little bit my experience. I'm not against the abortion on believing reasons or because of God or this or that. I'm a doctor. I've been instructed. I know from embryology that a sperm and an egg suddenly is just a different thing. You can call it a thing at the beginning. It explodes. It's an explosion of life. 2 cells, 4 cells, 8 cells, 16 cells, 32. Boom! In its own course. It's just a person. It's different from the mother and from the father, even when it's this small. My wife, I got married late. I was 29, almost 30. She was 29. And she was doing residency. I was chief of residence. We wanted to wait. I wanted to wait. She gets pregnant. I was married with a house, with an income, and I didn't want the baby. In my heart, I said, not the time, not my time. I don't want the baby. I was against abortion because I know it was a life growing there. Eventually, my wife had a miscarriage, and in my heart, I always feel I aborted that baby because I did not want the baby. And I saw my wife suffering because it was her first pregnancy, and she went down and she was depressed, and I committed. I said, I felt the anguish. I feel, I'm 30 years old. I'm a doctor. I have an income. I have a wife and a house. What else could I ask for? And I didn't want the baby. I can't relate to people who are desperate. The 15-year-old girl who got pregnant with the boyfriend, the woman who gets pregnant with someone who's not the husband. They're poor. I can relate to that. But the thing is this. As far as I stand for the breathing woman, who at that point was my wife, I have to make a stand for that person. Okay? If we don't do anything, that belly will grow. We know what's going on. It's not I can take care of my nose. If I fart and I can take off one of my ribs. Okay? I can do those things. Okay? And I understand it's in the woman, but it's by design. It's by nature design, if you want to call it. It's just the place to be. If you don't do anything, that belly will grow. It's what it is. And it's a topic that divides us, but I want to acknowledge those people who are on the other side, and they believe, I accept that, acknowledge that. In a human way, I admire if they're serious, but I just have to make a stand. What are we doing here? So Roe versus Wade didn't know what's going on inside. We know. I mean, my second pregnancy, my wife, she has bleeding. She's so sad. In Argentina, 1998, she had an intravaginal ultrasound. She had a hematoma behind the placenta. So the baby, it was a baby. Half an inch, less than half an inch, 12 millimeters, 3.5 weeks. And they put the ultrasound, I heard, that was his heart. What else can I need? And it was almost, you couldn't tell the parts. I've seen illegal abortions in Argentina. I've seen them coming in the process of getting the baby out. I've seen this small, maybe 2.5, 3 months, and they were perfect. You can see the head, you can see the arms, you can see the body. Why can't we expose what is really happening? Is it hard for us? We have the ability. There are the ultrasounds. I'm making a stand for that. It's a person, okay, in a process, okay? And they do breathe. They are exertional breathings, okay? The lungs are covered with fluid. They will breathe when they're out. But the heart is beating. They're moving. They sleep. They wake up. And this is a stand for something that is inside that woman, not from a religious standpoint. I studied it. Doctors, we know what's there, okay? And I wish that the public can see. It's just a simple ultrasound. Many times we don't want to see. It's better not to see, okay? If I don't know, if I don't see, it's better to deal with that.
Mr. Gonzalez, it looks like you've got a lot of things to say, and you're over your time limit. If you'd like, you can submit written comments.
That's fine. The only thing is that I agree that, thank you for your time. Sorry if I went too far. And I'm regulated. I'm a doctor. My facility is regulated. I want the same supervision for the health of the women who choose to go this way. Thank you very much.
Thank you, Mr. Gonzalez, for your time. Is there anyone who would like to speak who has not had a chance to speak?
Yes.
Okay, would you please, if you come around. And if you wouldn't mind stating your name and spelling it for the court reporter, please.
My name is William A. Klein. K-L-E-I-N.
Thank you, Mr. Klein.
And I'm president of Alabama Citizens for Life. We work with the legislature on composing the statute, and we have submitted a written recommendation to address to Dr. Geary. And we had one comment. We're very much in favor, and we're very thankful for the work that has been done. We had one comment to say pay a little bit more attention to Section 8 of the law, which requires rules and concerning the sedation and anesthesia and facilities for follow-up care, recovery, and reporting requirements. We think those could be a little stronger, and we would appreciate a view of that. The purpose of the law is not to stop abortions, but to make everything safe. And right now, abortion is legal, but it is not safe. And we've had too many instances in the state of Alabama where women have been seriously harmed, and we feel that these rules will help protect women. The unborn, we also wish that the statute would be reduced from 10 to 0. And we would recommend that it be much lower. We accompanied our statement by some of the rules in other states, which it is lower. Okay, and we would encourage that. But addressing, many of the statements that have been made here, the unborn child, as Dr. Virago stated, is very much alive, a human being, and without scissors. It's a person. I myself cannot understand why the legal definition of life differs from the biological definition or the scientific definition. That's just, I'm an engineer, and that just does not make sense. Okay, that'd be my statement.
Thank you for your time, Mr. Klein.
We have received the letter, and it's under consideration.
Thank you very much.
Is there anyone else? I'll call from the gentleman with the tie. If you wouldn't mind stating your name and spelling it for our court reporter to take down.
Thank you.
And you're limited to 5 minutes.
Thank you. My name is Sam McClure, M-C-L-U-R-E. I'm here as the president of Personhood Alabama, an organization that seeks to promote education an awareness of the things that Dr. Gonzalez spoke about, that scientifically, egg and sperm uniting creates a human being, and that human being is a person from the moment of conception, and as a person is entitled to the same legal rights as you and I have. One of my favorite pictures from the civil rights movement is a protest, a line of African American men walking down the street with a big sign on them with 3 words. It says, "I am a man." The same is true for these children, the persons. And so we support any kind of legislation that helps to protect the persons in the womb. I think this, in its essence, I think can be categorized as not a pro-life legislation. This is improving the health care of our state. I think whatever a person's view is of what happens when the egg and the sperm unite, when a human being's created, whether it's a blob of tissue or a human being or a person or a fetus, I think we can all agree that its worth is more than an eyeball. And I don't know that eyeballs can be removed from people without appropriate regulations and standards to ensure the safety of the patient.
Thank you, Mr. McClure, for your time. I see there's another name on here where there's, where they indicate yes. I'm having trouble reading it. Could it be, last name be Gray? Is there anyone here named Gray? Yes?